How does sexual activity cause UTIs? Imagine a busy night out turning into an unexpected health concern the next day. That's because sexual activity can sometimes lead to urinary tract infections, or UTIs. This happens mainly because bacteria from the genital or anal areas can be transferred into the urethra during intimacy. The bacteria most often involved are Escherichia coli, which naturally live in the intestines. When physical movement occurs during sex, it can push these bacteria into the urethra, the tube that carries urine out of the body from the bladder. Once bacteria enter the urethra, they can travel upward into the bladder, causing an infection. This process explains why UTIs are sometimes called honeymoon cystitis, especially in women who notice symptoms after sexual activity. Women are more prone because their urethra is shorter and located closer to the anus and vagina, making it easier for bacteria to reach the bladder. The risk of developing a UTI increases with more frequent sexual activity, as each encounter offers another chance for bacteria to be introduced. It's important to note that sexual activity itself does not cause sexually transmitted infections, but it can facilitate the transfer of bacteria that lead to UTIs. Other factors can also raise the chances of getting a UTI after sex. Not urinating soon after intercourse can allow bacteria to stay in the urethra longer. Certain contraceptives like diaphragms or spermicides can irritate the urethra or change the natural balance of bacteria in the vagina, increasing infection risk. Hormonal changes, especially during menopause, can weaken the bladder's defenses, making infections more likely. From a bladder health perspective, recurrent UTIs caused by sexual activity can lead to ongoing inflammation of the bladder lining. While UTIs are not directly linked to bladder cancer, persistent inflammation and irritation could contribute to bladder problems over time. To help prevent UTIs, good hygiene is key. Urinating after sex helps flush out bacteria before they can cause an infection. Drinking plenty of water and avoiding irritants like harsh soaps can also support bladder health. If symptoms of a UTI appear, seeking prompt medical care is essential to prevent complications. In summary, sexual activity can cause UTIs by mechanically moving bacteria into the urethra, where they can ascend to the bladder and cause infection. Women are especially vulnerable due to their anatomy. Preventive steps like urinating after sex, maintaining good hygiene, and staying hydrated are simple but effective ways to reduce the risk. Always consult a healthcare professional for personalized advice and treatment options.